but almost on a weekly basis, we're moving very rapidly, far at a number nobody thought possible.
Well, let's just fact check this. Yes, the US has conducted more tests than anywhere else, it seems, but not on a per capita, per person basis compared with other countries. Now, there are millions of tests out there, but as we heard from the experts and supply chain people just in the coronavirus briefing just now, a lot of them are on the market, but you can't necessarily get everything you need to ramp up testing. Parts of the kit aren't available. Now, it is being ramped up, but the question is it quick enough, Anand?
Nathan, one other issue, and that's the economic impact of this coronavirus. We expected to see a new interim coronavirus aid bill or relief bill from Congress by now, but apparently negotiations have hit a snag. What's the problem there?
Well, they've been hitting a snag for the last week or so, and we thought there was going to be a deal sometime Monday, but it looks like it's going to stretch till Tuesday. Essentially, you know this payment protection plan, the $350 billion that was doled out to small businesses. It ran out of money so quickly. This basically paid companies to keep on their workers with interest-free loans. However, it went very quickly because a lot of it went to actually bigger companies, not just small businesses. We heard of Ruth Chris, the steakhouse, Shake Shack. They gave the money back, by the way. But they're looking for another $300 billion. The Treasury Secretary, Steve Mnuchin, thinks it's an excellent program. The trouble is that there are other wants as well. The Democrats are saying, look, the states that have been hit the hardest need monies to fix their fiscal problems, like New York, for example. They just asked for $4 billion. They didn't get a lot the other time round. Hospitals, too, need money because, believe it or not, COVID's cost them money because elective surgeries are off, and because this healthcare system is a marketplace, they're actually laying some people off and cutting wages in some hospitals. So it's a dramatic need. There's also talk of bailing out the post office and others as well. So they aren't in agreement yet. And remember, Congress doesn't want to come back and vote because that would be not social distancing. So they all have to agree remotely and do it on a voice vote. We are expecting another agreement potentially in the next 24 hours. Now, the price tag is going to be interesting. It could be close to $1 trillion on top of the was it 4 or 6? I can't exactly remember now, but that's just an incredible number.
Thanks, Nathan. That's CGTN's Nathan King reporting from the White House. Well, there is much to talk about. Let's get to our panel. Xindo Xu joins us from Beijing. He's a senior fellow with the Pango Institution and host of CGTN's Dialogue Weekend. Joseph Williams is the senior news editor for U.S. News and World Report right here in Washington, D.C. And also with us from Washington is the director of the Global Biorisk Advisory Council, Gavin McGregor-Skinner. Thank you to all of you for joining us. Gavin, let me start with you. And we've been talking a lot about tests, but I want to talk to you about the antibody tests, which are being seen as essential to the reopening of the country. What is an antibody test, and what will it tell us that will guide us on when and how the economy can be reopened?
That's a great question. It's really important that everyone understands that this antibody test and there's been lots of them. There's been over 70 of them that have been rushed through by the FDA at the beginning of April. And we've got to ensure that they provide a good quality, a high sensitivity precision test. They get the answer right. But the test actually at the moment is a qualitative test. So it'll say yes or no. Yes, did I get infected? Or no, did I get infected? It's not a quantitative test where it actually measures the level of antibodies so that we can determine the level of possible immunity. So at the moment, it's just a qualitative test. Yes, I was exposed to the virus. There's been some problems with these tests, though, and we're very concerned at the quality, the number of tests that have been approved by the FDA, and whether they actually meet the standards that we require in opening up the rest of America based on these tests.
So, Gavin, do we have any idea of how reliable these tests are?
Well, a term that everyone's going to hear a lot about and have to learn and understand, it's these false negatives. When you hear the false negatives, that's where someone has either been exposed to the virus and has shown to be, and when you test them, they actually prove, the test shows that they haven't been exposed to the virus or they haven't been infected. So what we're really concerned about is whether there's two antibodies that these tests test for. It's called IgM and IgG. The IgM antibodies are the ones that you develop really early on when you're infected. The IgG antibodies are the ones that you develop much later, and they provide the immunity. At the moment, those tests are not detecting the IgM very well, and this is something that everyone's looking at, and more research needs to be done.
Joseph Williams, let's go back to the economic impacts of the coronavirus. There's a new relief package, which I talked to Nathan about a moment ago, for small businesses and others. That's on the way. It's worth $500 billion. The Paycheck Protection Fund has already been used up, got used up very quickly. There is also funds for testing and for hospitals. So put this in perspective for us. How long will this tranche of money, $500 billion, last? And will it keep businesses afloat?
Well, if past is prologue, it's not going to last very long. I mean, we're talking about billions of dollars that were appropriated, and mind you, this is the fourth bill that has been passed or examined to kind of cushion the blow to the economy. And we've blown through this money in weeks, if not months, and there's no end in sight to the misery because we still don't understand exactly how many people have been infected, and that will determine whether or not the company reopens. So it's understandable the anxiety that President Trump feels to reopen the economy because it is costing billions, and the more money that's flooding the market, the worse it's going to be to try to get things restarted because you run the prospect of inflation, you run the prospect of running up a huge deficit. So the money is there, they're going to have to pass it, and it's going to be a big bill. It has to get to the right people, but we still need to go back to testing in order to determine whether or not the economy can reopen and we can get tax revenues going, we can get income revenue going to try to offset these huge amounts of money that they're throwing into the system.
Joseph, are we going to get to the point, and that point might come very soon, where Congress is going to have to vote on a bill that gives us regular payments, probably for the next few months?
It's not out of the question, especially as long as this virus continues. We're looking at a real-time experiment in a lot of ways of the concept of universal basic income, which was Andrew Yang's platform and which has been tested in various cities across the country. And it's an emergency kind of experiment, and we'll find out whether or not it will indeed prove dividends. The problem is that a lot of times it's not quite enough money to get you afloat or to keep you afloat, given the fact that this virus, we have no idea how long it's going to last. And one or two payments, that will help keep people afloat. But until we get testing and can return people back to work, it's just going to be a patchwork, and it's not going to be a sustained kind of way of life for people in order to keep them out of debt and keep them in kith and kin for the time being.
All right, let's go to Beijing and bring in Xindo Xu. Xindo Xu, I want to talk about another development. You know, we know that there's a lot of politics in this coronavirus outbreak, but there is a story making the rounds of U.S. television channels, Fox News in particular, that the coronavirus was first detected late in 2019, in December 2019, and it originated in a laboratory in Wuhan in Hubei province, and then it was accidentally, it escaped. That lab, of course, has denied this, but that's not stopped the allegations. But what does China make of this?
Well, this is one of the many conspiracy theories going around since the beginning of the outbreak in Wuhan. Of course, there are all kinds of allegations. You know, some people will say this was brought to China by the U.S. military. Some say this was made in the Chinese lab, or it was a virus escaping the Chinese lab, etc. But it has been proven by actually researchers and also research papers like by Chinese scientists, by scientists from European countries, British, German scientists, and also WHO. It was not the case. It's not from the lab. And also, if you, people are careful, you pay attention to that, nobody from the lab actually got infected by this virus. And so there's no infection of anyone from the lab. So this is just one of the conspiracy theory. I understand for media, people are interested in that kind of allegation or the theory. But if it's pushed from the government, it's not really wise. I would say this has been dismissed by a lot of scientists from the very beginning, a long time ago, actually.
Right. So at the beginning, Xindo, we heard that the virus actually came from an animal, transferred to a human, and then from a human to a human.
Yes, it was basically people believe, from the research papers, it was from the bat, and then there's the animal, they call it like the host, some kind of animal, and the animal obviously has close contact with human being. So it transmitted from bat to the animal. We call it the host, and the host transmit the disease, the virus, to human being, and then human being to human being. This is largely based on what we understand the process of transmission.
Okay, Gavin, talking about testing for the coronavirus itself, separate from tests for antibodies, there still appears to be a shortage of tests. This was the Maryland Governor, Larry Hogan. He was talking about this. Let's listen to what he had to say.
I think this is probably the #1 problem in America, and has been from the beginning of this crisis, the lack of testing. And I've repeatedly made this argument to the leaders in Washington. The administration, I think, is trying to ramp up testing. They are doing some things with respect to private labs, but to try to push this off to say that the governors have plenty of testing and they should just get to work on testing, somehow we aren't doing our job, is just absolutely false.
So, Gavin, tough words there from the Maryland governor, but I should say that there has been news since he made that statement that Maryland, the state of Maryland here in the United States, has managed to secure something like 500,000 tests from South Korea. He used a family connection there to get those tests. But how serious is the shortage?
Well, this is important because we've been focusing so much on the numbers of tests, and that these numbers of tests we've seen increase over the last few weeks. But you've got to appreciate there's a number of components, there's a number of pieces of equipment that you need to actually do a test for the SARS-CoV-2 coronavirus that causes COVID-19. What we haven't focused on, this is what's going to become really important now as a critical tool in our toolbox, is maps. So when we start mapping down at the neighborhood level, where have we tested? Where are those people in neighborhoods that haven't received any testing? So it's more importantly now, we start looking at the tests that we have available, and we look at location, by using maps of where those significant gaps are, of where we haven't tested any of the citizens, any of the population in certain neighborhoods, and then we need to go and find out what's going on in those areas. And that's that's part of our next steps to getting all that information so we can make better evidence-based decisions on where this virus is and where it isn't.
Joseph, looking at where we go to from here, there has been a plan which was released by the federal government, by the White House actually, or guidance really, on how states could reopen the economy. They have to fulfill certain requirements, meet certain criteria. There's a phase 1, phase 2, and phase 3 in those plans. But we are seeing demonstrations in a handful of states, not many states, and the demonstrations are not big, just a few hundred people, trying to pressure governors, and mostly Democratic governors in these states, to reopen. We also had a situation in Georgia announced just a few hours ago that the Georgia governor announced that gyms, bowling alleys, hair salons, and tattoo parlors, of all things, will be allowed to reopen on Friday, this Friday. They would have to follow social distancing guidelines and practice other personal hygiene guidelines. On Monday, they will be allowed to open movie theaters, and restaurants would allow people to come in, limited dine-in options. Where's this going to? I mean, shouldn't there be I mean, there is a set criteria, but shouldn't there be an enforceable set criteria for these governors to meet first before they do this?
There should be, and there isn't. And you see these states opening, they all tend to be governed by Republicans for the most part, Texas among them. They're looking at reopening very slowly, reopening schools and such. But this is what happens when you have a vacuum of leadership at the top. President Trump has said consistently, it's not my job to manage this crisis. He's resisted for several weeks before, as the crisis was ramping up, in calling it a crisis, and has consistently said that the governors are basically on their own and that the federal government is a backstop. Now, as far as the protests are concerned, again, happening in Democratic states, so there's a little bit of political gamesmanship happening here too, because a lot of the protests were what we called AstroTurf, which is they're not organically grown protests. They're basically sponsored by this cause or that cause, promoting people to agitate in the streets and put political pressure on governors to reopen. But look, the problem here is, as the good doctor said, we don't really know what we don't know. We don't know how many people are asymptomatic, for example.
Right.
We don't know how many people who will transmit the disease to others, even in casual contact at a movie theater or such. And it seems like a not great idea to start reopening when we're still basically trying to build the plane in midair to figure out exactly what kind of pandemic we're dealing with and what the curve could look like in order to reduce these infections.
Yeah, and this was also announced in Atlanta, which, as we all know, is home to the world's busiest airport. Shindo, very quick question I have for you here. We're hearing some reports that China is looking at easing plans on travel. It's going to allow business people to travel. Do you know anything about that?
Well, yes, that's being reported also in China, mostly between China and Asian countries. For example, China, Singapore, China, South Korea, because there's, if you want to resume full economic activity, there's a problem of fixing the global supply chain, which is broken because of the outbreak. So basically, China is talking to those countries like, they have a mutual recognition of testing of those business people, and then they don't need to be quarantined after their arrival for 14 days. So they can start their businesses, meeting local people or checking the plants immediately. So in that way, both countries will benefit in terms of their recovery of their economy.
Right. Okay. Thank you very much. That's Shindo Xu, Joseph Williams, Gavin McGregor-Skinner. Thanks to all of you for being with us. Now, the race is on for a coronavirus vaccine, but a vaccine's effectiveness can depend on a person's age and immune system. I spoke earlier with Dr. Ofer Levy. He heads the Precision Vaccines program at Boston's Children's Hospital. Dr. Levy, thanks so much for joining us.
It's my pleasure.
Let's start by talking about the groups that are most vulnerable to the coronavirus. The Centers for Disease Control tells us that elderly people are twice as likely to become severely ill with the virus than a younger, healthy person. But you've expressed concern that the vaccines that are currently being developed may not be as effective in older patients. Explain that to us.
Well, my father likes to say, the only constant thing in life is change. Now, this is an ancient saying. It goes back to the ancient Greeks, and it's true of all of us. It's true of all of our body systems, and the immune system is no exception. From the day we're born to the day we die, our immune system continues to change. And it's been observed for many years now, in fact, for millennia, that as we age, we become particularly susceptible to infectious diseases. This is true of the very young, newborns. The immune system is weak, to give it a simple term. It's more complicated than that. And again, as we age. So infectious deaths in general in the world, across all infections, are most common in the very young and in the elderly. And of course, with this deadly coronavirus pandemic, it seems to be hitting particularly hard the most elderly. Now, the same attributes that render the elderly susceptible to severe infection also sometimes conspire to weaken a response to a vaccine. This has been seen across a range of vaccines, but one example is the seasonal influenza vaccine. For any vaccine we give, there's a proportion of responders who might make a robust antibody response, for example, to the vaccine, and a proportion of non-responders. And among the elderly, there tend to be a relatively higher percentage of individuals who don't mount a robust immune response to a vaccine and may not fully benefit. Of course, the elderly should make sure they get fully immunized. The vaccines are helpful, but in designing vaccines, we have to bear in mind that the immune system of the elderly might not mount an optimal response.
Right. Now, given those factors, you are taking a different approach in your research. You are using blood samples, white blood cells from elderly patients, and you're also creating or modeling an immune system, and in the hope that you could boost the immune system with that kind of research and a vaccine. How does that work?
Well, typical vaccine development over the past 100 years, and let's be clear here, other than clean drinking water, the most important biomedical intervention known to humans are vaccines. And the vaccines we have are great and very helpful and prevent a lot of disease. That said, the path for their approval, if you look back in history, it's taken 10 to 20 years typically from an inception of an idea to having a licensed scaled vaccines that's given to a lot of people. And typically the way it's developed is, at least in the initial stages, disregards the attributes of the target population. And so work is done in a laboratory, and then in mice, and then in larger animals, and eventually in humans. And that's a typical path for a vaccine development. But this path that disregards species specificity, disregards the attributes of the population, such as age and sex, etc., can lead to some failures and can also lead to slow development processes. We at the Precision Vaccines Program at Boston Children's Hospital and Harvard Medical School have turned the process on its head. We put the human consideration at the start of the process, and we do this by collecting blood from volunteers and testing their white blood cells outside the body, modeling a human immune response to a vaccine that's age-specific. So we can culture elderly leukocytes or white blood cells outside the body and test vaccine formulations, including molecules that might boost immunity called adjuvants, and choose those that look like they might be most promising in the elderly, and then advance those into the animal models and beyond. So it's a very different way to approach vaccine development.
So this vaccine that you're developing, will this be effective in all ages?
We hope it will be. We're starting off with putting a priority on the elderly, but we will also test in other age groups as well. Right now, we have one adjuvant formulation that we've tested outside the body, that we've also tested in mice, and has shown some ability to enhance an antibody response to the coronavirus spike protein. Your viewers may have seen that the coronavirus looks like a ball with spikes on top of it, and the virus needs those spikes to enter the host cell. So we would like to create a vaccine, and others are working on this concept as well, where you inject the spike protein, the body makes antibodies against it, and they block the ability of the virus to infect. The value of the added adjuvants are that with an adjuvant, you can often have an effective vaccine with a much lower dose of the antigen, the protein part, which is quite expensive. Remember, even when a successful clinical trial is announced for a vaccine, which will be a great milestone, there's still the matter of scaling this to hundreds of millions to billions of doses. And an adjuvant, a molecule that boosts an immune response, might be an important part of the solution there because it may allow a vaccine with a much smaller content of the expensive protein, and it may increase the durability of the response. In other words, single-shot protection against coronavirus would be a worthy goal, and bring in a strong response in the vulnerable elderly. So for all these reasons, we're very enthusiastic about the potential inclusion of an adjuvant molecule into such a vaccine, but we believe it's important to select an adjuvant that would work very well in the most vulnerable population.
So, Dr. Levy, what kind of timeline are you looking at to have this vaccine on the market?
Okay, that's an excellent question. And of course, we would all like to have a vaccine yesterday. It depends a little bit on what our lead adjuvant formulation is. If the adjuvant is something that's familiar to the biomedical establishment and has been in other vaccines, that makes things a bit faster because there's a familiarity and a little bit more of a safety database. If, on the other hand, we have some options or combinations that look very promising, but are completely new kinds of molecules that have never been in humans before, that might take a bit longer. You see, there's a real natural tension between the speed of the process of developing a new vaccine and the need to keep an eye on safety. Vaccines are something you typically give to healthy people, so you want to be assured that what you're giving is safe. All of this said, I would think that we're looking at a 12 to 18-month time frame to get towards human studies.
Very quickly, Dr. Levy, would you be able with this vaccine to eradicate the virus completely, or would it be an annual thing where you'd have to get the vaccine every year?
That's an excellent question, and we really don't know the answer to that. As you may have heard, Dr. Tony Fauci, the director of the National Institute of Allergy and Infectious Diseases, NIAID, has pointed out that this coronavirus may become a circulating virus like the flu, which has ebbs and peaks potentially in the wintertime. And in that context, we may be in a scenario where a yearly shot is needed. Of course, again, if we have a very effective vaccine, perhaps an adjuvanted one, where it induces long-term immunity, maybe we wouldn't need a yearly shot, but this is all speculative. We're still learning so much about this virus and so much about the immune response to it.
There is much debate right now in the United States over opening the economy or reopening the economy, as we hear very often, and much of it has taken very political overtones. But a lot of that is dependent on testing around the country. What are your thoughts on that?
Well, that's absolutely true. I mean, I think it's absolutely critical to know who's infected and who's not infected. And right now, it seems to me that we are further along with the PCR-based tests, like the nasal swabs, et cetera, that will tell you if you have the viral genetic material around and diagnose you that way. But in terms of testing for your antibody response, this is not where we'd like it to be yet. And for all types of tests, both the swabs, PCR swabs, and for the serology, as we call it, the presence of antibodies against the virus, it seems to me that we need to rapidly increase the capacity of our country to test as many individuals as possible every day. That's going to be a key for reopening the economy more effectively and more safely.
Dr. Ofer Levy, thanks so much for joining us.
It is my pleasure and an honor.
And that is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.